Just a reminder to folks, we will be using the Q&A function on the webinar today. So if you have any questions, it should be located there on the bottom of your screen. Feel free to use that for any questions you have. We'll have some time at the end to answer any questions, and we'll let folks know when we hit our time limit, just in case we get lots of questions and excuse me, and need to go over time. With that, seeing room kind of populating and everything, I would like to welcome everybody to our webinar today on climate and health in Region 7, understanding the impacts and preparing for the future, with Rachel Lookadoo. Rachel Lookadoo is an assistant professor in the epidemiology department of the College of Public Health at the University of Nebraska Medical Center, serves as the deputy director of the Center for Biosecurity, Biopreparedness, and Emerging Infectious Diseases. She also acts as the director of public health policy for the Water, Climate, and Health program here at UNMC. Ms. Lookadoo's background is as an attorney, and she focuses on the various legal and regulatory issues that can arise in emergency preparedness and response. She specializes in healthcare surge events, isolation and quarantine law, public health impacts of climate change, crisis standards of care, infectious disease response, and general legal preparedness. Ms. Lookadoo also conducts emergency preparedness trainings and assessments for public health departments and healthcare facilities nationwide. Ms. Lookadoo received her Juris Doctor degree from American University, Washington College of Law, and her bachelor's degree from Baylor University. Go Bears. All right, with that, I will turn it over to Rachel to lead us through our webinar today.
Thanks, Tom. All right, let me share my screen real quick. All right, well, it's so good to be here today. As Tom said, I'm going to be talking about climate and health in Region 7. So we're going to be covering a few different things. I'm going to start by talking about climate change generally, some of the extreme climate events that we've seen here in the region, some of the health impacts of climate change, and then what can we do, focusing mostly on healthcare and healthcare coalitions. So anytime I talk about climate change, I like to start with the Yale Climate Opinion Maps. And so I like to do this because I think a lot of times we think of climate change as this very political issue, which it is for a lot of people, but we don't necessarily think about how many people really think global warming or climate change is happening or think about climate change. We think of it as very divisive. And so I like to start these presentations by looking at what do people actually think. So this is, like I said, the Yale Climate Opinion Map, and it just came out in January of this year. I used to use the 2021. They just released the updated version for 2023. When you look at this map, you can see that nationally, 72% of adults think that global warming, that's the term that Yale chose to use, think that global warming is happening. That might be higher than you would expect. You can see in Region 7, we're right around the 65 to 70%, so pretty close to the national average in our Region 7 states. So this map is a little bit different. This one is looking at the percentage of adults who think that global warming will harm plants and animals. So here we're right around 70%, so close to the national average for thinking global warming will happen generally or is happening. But this percentage actually went down from 2021 to 2023. It used to be, I think, 72%, went down to 70. You can see in our Region 7 states, we're still right around 65 to 70%. I think part of that is probably because we are heavily agricultural states. Ag is a big industry in all 4 of our region states. So it makes sense that we would be thinking about how does global warming, climate change affect our environment. This next one is the one that I really want to focus on. So this map is looking at how many adults think that global warming will harm people in the US. And you can see the numbers have gone way down. This map is a lot lighter than the other ones were. So this number went down pretty significantly from 2021 to 2023. The number had been 65% as the national average, and now it's down to 61. In the 2021 map as well, there were no states that were that blue color, but now you can see we've got North Dakota, Wyoming, West Virginia. They've all gone down to under 50% of adults think that global warming could harm people in the US. Here in our region, 7 states, we're right around 55 to 60%. But again, I just wanted to kind of provide these to sort of level set of what do people actually think about climate change in the US and in our region specifically. So let's talk about climate change, what that actually means, and what some of the extreme climate events are that we've seen in the region. So to start, I want to talk a little bit about some of the language that we're going to use in this presentation. So sometimes people confuse weather and climate, and they're very different terms. So here's a quote that climate is what you expect, weather is what you get. And to drill that down a little bit further, weather is the current conditions of the atmosphere. That is things like it's raining right now, or it's partly cloudy, it's a little bit hot. It's variable, it changes all the time. In the Midwest, it feels like it's changing every second. But that's just really looking at what does it look like outside right now. Climate, however, is looking at patterns and trends and the behavior of the atmosphere over really long time periods. So climate is how we know that summer is warmer than winter. It's how we know Nebraska is probably cooler than Florida. We know that this last year, 2023, was warmer than previous years. So it's that long-term systemic patterns and trends that we see in changes in our climate. So by the same turn, I want to define climate change and climate variability. So climate change is referring to the long-term continuous change in temperature and weather patterns over a long period of time. Climate variability is a fluctuation above or below long-term averages of temperatures. And then extreme weather, I think we all know what that is, but just to clarify further, that's any weather phenomena that's outside of the norm. So floods, heat waves, drought, you name it. And I put this graph here. This is looking at anomalies in the global land and ocean temperatures going back to 1850. And I share this because I think it's really pertinent to see how things have changed over time. So here we have in 1850 to roughly 1940, 1930, things are a little bit cooler. They're lower than the average. The anomalies are all in the cooler region. But then you can see from 1940 on, temperatures have just steadily risen. They have continued to get higher and higher. So we can see this is what climate change is referring to. This is what we mean by that long-term change in temperatures getting warmer over time. So it's not just changing temperatures that we're seeing with climate change. This is why a lot of people don't like to use the phrase global warming anymore, because that is really just one piece of the puzzle of climate change. It's not just global warming, it's a lot of different changes in our climate. So yes, we do see rising temperatures, but we also are seeing more extreme precipitation. A lot of storms, severe weather is happening more frequently with more intensity. We see more flooding. We've seen a lot of that in the Midwest. There's more hurricanes. The hurricanes that do happen are more intense than they have been in previous years. They happen a lot more frequently and for longer periods of time. We're seeing sea level rise. We are seeing a lot of increased drought across the United States. Definitely a lot more heat waves. Those are more frequent. They're more intense. And then wildfires. We're seeing wildfire season is really growing. It's starting a lot earlier and it's going a lot further into the year. In fact, I think the term wildfire season could potentially become a misnomer because wildfires are happening so frequently and for such a long period of time in the US. Additionally, you can see that one at the bottom about cold waves and winter storms. So we're having less frequent and less intense cold waves across the country, but we're having more intense and more frequent winter storms. So I just think this is interesting to see that when we talk about climate change, it's not just about things getting warmer, it's really covering a whole range of climate events that are happening. So I thought I'd ask a question here. I'm not sure if you can access the chat, hopefully you can. But I wanted you to think about what kind of climate events have you seen in your state or your community or wherever you are. And you can put that in the chat if you want, or just think about it for yourself. You know, what are the kind of extreme climate events that you're seeing where you live and where you work? And I'll share a few with you that we're seeing in Region 7. So this is the U.S. Drought Monitor map. This is a map that's put out by the University of Nebraska at Lincoln. It's released every Thursday. So this is the one that was released just last Thursday. And you can see that in our Region 7 states, every single one of our states is in some level of drought. So there's different intensity of drought. You can see that legend on the side there. We can see that in Iowa, there are parts of the state that are in that D3 level extreme drought right now. You can also see over Nebraska and Kansas, there are areas that are labeled as being in long-term drought. That means that those areas of the state have been in drought for at least 6 months or longer. So we have a lot of drought in our region. Obviously, you can see there's drought elsewhere across the country, but within Region 7, we have a significant amount of drought. You can also see that here. So this is a map of the U.S. average drought levels in 2023, and it's based on the Drought Severity and Coverage Index. And so this is basically just a way of taking the drought levels that were in that U.S. Drought Monitor map that I just showed you and turning it into a measurable value for each county in the United States. And again, when you look at this map, look at Region 7. We have some of the darkest colors on that map of the most severe and longest lasting drought in the country. So again, just interesting to see that we have a lot of drought in our region. It's not just drought. We are also experiencing extreme heat. You may have heard this. 2023 was the warmest year on record for the world. It was the 5th warmest year on record for the United States, but globally, it was the warmest year on record. And when you look at this map, this is showing the number of extreme heat alert days between May and October of last year. So in a 5-month time period, this was how many heat alert days there were in the US. And it's not surprising that Texas, Arizona, Louisiana, they have the highest amounts. They're more than 60 for that 5-month time period. But look at our states here. You can see Missouri and Kansas were in that 3rd highest level of days, 21 to 41 extreme heat alert days in that 5-month time period. And then Nebraska and Iowa, anywhere from 7 to 20 extreme heat alert days for our 2 states there. So just to show that we're really experiencing a lot of that extreme heat as well. We've also seen a lot of heavy downpours, extreme rainfall, and severe storms. So this was an event that occurred back in 2022. You may remember when this happened. But Missouri, Kentucky, and Illinois all got hit with this crazy, crazy rainstorm in a very short time period. The city of St. Louis actually had 25% of their annual rainfall amount in less than 12 hours. So really intense rain caused a lot of flash flooding, had huge impacts on those communities. And if you talk about flooding in the Midwest, you have to talk about the Missouri River. So when I give this presentation in person, I usually like to trick people, which is not very nice, and make them guess what year this is from. So this is a picture here of the Fort Calhoun nuclear plant a little bit north of Omaha. This is a picture of Hamburg, Iowa. And this is a levee in Atchison County, Missouri, actually close to Hamburg, Iowa. And a lot of people think this is 2019 because that was a major flood that we had. This is actually 2011. We have had a lot of intense flooding in Region 7. And so you may recall when the 2011 flood happened, people said, oh, this is a 500-year flood. And a lot of folks took that to mean, oh, this is something that could only happen 1 in 500 years. But we know that's not the case because in 2019, we had a gigantic flood. And this flood, the 2019 flood, was considered a 100-year flood. So I want to clarify the language around that because I think that it's very confusing the way that it's often used in the press. So when someone says that something is a 500-year flood or a 100-year flood, what that actually means is that there's a 1 in 100 chance or 1% chance of this level of flood happening in a given year. A 500-year flood means that there's a 1 in 500 chance of that level of flood happening. So just to clarify that language, because I think it's very confusing for people when they hear that, it obviously sounds like it means it's once every 100 years, once every 500 years that these sort of floods occur. But that's not actually what that means. So we'll talk more about the 2019 floods in a little bit, but I wanted to share these images as well. So these two pictures, one is of Hamburg, Iowa. Another is just another shot of I-80, or not I-80, I-29, I guess it is, sorry, in the 2019 floods. And I share these to show that the same areas are being hit by these extreme floods each year. So the 2011 floods, the 2019 floods, there have been other floods in between. They tend to keep hitting the same places over and over again. So these communities that are impacted by the floods have to really be thinking about how can they be more resilient for these kind of events? How can they rebuild in a way that is going to be mindful of future flood events occurring there? Because they probably will. We know that they will because they have happened many times. So all of this leads to thinking about all the different types of climate disasters, extreme climate events that we see in the US. I wanted to share this graphic here of billion-dollar disasters between 1980 and 2023. So when you look at this, it's showing all the different types of natural disaster types that have caused billion-dollar disasters. So a disaster that cost more than $1 billion in damages. And you can see a little bit of everything here: drought, flooding, freeze, severe storm, tropical cyclone, that includes hurricanes, wildfires, and winter storms. And when you look at the total cost for all of these types of events that have occurred in that, what was it, 1980 to 2030, 33-year time period, 43-year time period. Oof, I didn't like that math. But the total cost for $1 billion disasters for that time period was $2.6 trillion. So this is a significant cost for the US, is these types of disasters. They're also causing a significant amount of deaths. We see there have been over 16,000 deaths due to these types of natural disasters during that time period. So again, I just wanted you to take a look at that, see all the different types of extreme weather events, extreme climate events that are causing significant financial cost, but also cost of livelihood in the US. Also, these types of events, these billion-dollar disasters, are happening a lot more frequently than they used to. So this graph is showing the number of billion-dollar disasters by type from 1980 to 2023. And we can see that in 1980, there were just $3 billion disasters during that time. But in 2023, we had 28. And if you look at the trend over time, it's a significant increase in how much more these events are happening. And this graph is adjusted for inflation. It's to account for changes in cost. So it's really staggering to see that we're having $600 billion in cost for disasters in 1 year now, when previously it was a much lower amount. So just kind of interesting, again, to see those trends over time. This is what we mean when we talk about climate change. These are the trends that we're seeing over long periods of time. I also want to note, you'll see the different colors in this graph represent different types of disasters. So the green is really the one that takes up the most space in almost every year. And those are severe storms. That makes sense. We see severe storms quite a bit, so it makes sense that they would be included. But I also want you to note the brown on the bottom, the little kind of tan color squares on the bottom, that's drought. So we have drought events almost every single year. So just to be mindful of that, billion-dollar drought events every single year, almost, with just a couple of exceptions, since 1980. So not only are we seeing more of these types of disasters, but we're seeing there's a lot less time between them occurring. So this graph shows the same time period, 1980 to 2023, and it shows the number of days on average between these billion-dollar disasters. In the 80s, it was, around 80 to 100 days on average between billion-dollar disasters. But in 2023, it was on average 16 days between these types of disasters, which is really fascinating to me. That is a crazy thing to think about, it only being roughly 2 weeks between billion-dollar disasters. Think about that from an emergency management perspective, the cost associated, the people who would need to be deployed for these types of disasters. It's really staggering to think that it's that short of a turnaround time on average between disasters. It's also interesting, I think, to note on this graph and the one before, 1987, there were no billion-dollar disasters. I don't know what was going on in 1987, but they were having it pretty good in terms of disasters. So this map here shows all of the billion-dollar disasters that we had in the United States last year. Like I said, there were 28 of them. It cost altogether about $92 billion in total cost, and it caused 492 deaths last year. So when you look at this map, you'll see there's a lot centered right around our region. The things that we had in our region: tornadoes, hailstorms, severe weather, no flooding last year, which is good. But you can see in other parts of the country, there were floods, there were hurricanes, there was the Hawaii firestorm. So it's a real mix of different types of disasters that occurred last year. But I just wanted to give you that perspective of all of the different billion-dollar disasters that we faced in 2023. So let's talk now about how this actually impacts people's health. So it can be hard to think about how climate affects health. It's not always an obvious connection between climate change or extreme climate events and health, but it does affect our health pretty significantly. So climate can affect our health in direct ways. That's like things like extreme heat causing heat stroke or different types of heat-related illnesses, air pollution causing respiratory issues, extreme weather causing injury, death, displacement, but also in a number of indirect ways as well. So you can see those here. Spreading disease, we see an increase in vector-borne diseases, which are diseases spread by insects, ticks, rodents, contaminated water, contaminated food. We also see issues in food supply. So we know with drought and with flooding, it can really impact crops, livestock, you name it, and that can lead to hunger and malnutrition. I remember in the 2019 floods, we had a lot of farmers who lost significant amounts of livestock as well as crops. So that's a huge impact directly from climate to food supply. And then also, we know that climate disrupts people's well-being. It causes a lot of mental health issues, and we're still starting to understand how climate can impact conflict and displacement. But we know there can be conflict over dwindling resources. So the more that there is a shortage of water, for example, or fuel, or whatever the case may be, that will probably lead to increased conflict. Also, I saw a statistic that in 2022, climate disasters, extreme weather events, triggered 32.6 million displacements of people. And that was all internally. It was displacements within their own countries, but still, that's a significant amount of people who were displaced from their homes due to climate events and extreme weather. So we know that climate change is a significant threat to the health of the American people. It's to the health of all people in the world. And this was shown in a report that was done in 2016 that was commissioned by the White House on the impacts of climate change on human health in the US. And you can access that report at the website listed there, but it goes into a lot more detail about how climate change is impacting our health. So this slide is just a different perspective of how climate impacts health. It's kind of like a spinning wheel of doom, but it's really useful to understand the relationships here. So with climate change, we know that we have rising sea levels, increasing temperatures, increasing CO2 levels, and more extreme weather. Those things have all been borne out by studies. And with each of those things going on, that leads to the impacts in that second ring there. So we see impacts to water and food supplies, environmental degradation, extreme heat, severe weather, changes in vector ecology, again, vectors being mosquitoes, ticks, rodents, different types of things that carry disease, air pollution, increasing allergens, and water quality impacts. And it's that second ring there, those are the things that actually lead to health impacts. And you can see here some of the different health impacts listed. It's a pretty wide range. There's malnutrition, forced migration and mental health impacts, heat-related illness, injuries and fatalities from severe storms, all of the vector-borne diseases listed there, asthma, cardiovascular disease, respiratory issues, obviously, cholera, water quality issues there, harmful algal blooms. I don't know about y'all, but I feel like I always see alerts about harmful algal blooms in lakes in the area and recreational water. So we're seeing all of these different types of health impacts, and they all circle back to that inner ring there. So this is how it all kind of connects. Now, this is just a different graphic looking at the same issues. How does climate change impact health? So again, we have those climate drivers. That was that inner ring on the last slide. Increased temperature, more extreme weather, more extremes of precipitation. That leads to extreme heat, poor air quality, reduced food and water quality, changes in vector-borne diseases or infectious agents. And then that leads to health outcomes like we saw, heat-related illness, cardiopulmonary, food, water, vector-borne disease, mental health, etc. But what I like about this graphic is it also includes the context, which is incredibly important in understanding how climate change affects health. So on the one side there, we have environmental and institutional context. So this is things like infrastructure of a given community, ag production, geography, built environment, all of these different elements that can affect how people experience climate and how it ultimately affects their health. If they're in a city that has a built environment that's more climate resilient, that will affect how much they experience the impacts of climate change. If they're in a place that is heavily reliant on ag production or livestock, then they will also probably feel the effects of climate change differently. And then on the other side, we have social and behavioral context. And this is incredibly important because we know that climate change impacts people differently. Some people have a disparate impact to climate change and its health effects. So those contexts include things like age, gender, race, ethnicity, socioeconomic status, housing status, education, access to healthcare, etc. So all of those things will have a significant effect on how people experience these climate-related health concerns. And so what that tells us is if we can address some of those contextual issues, whether they're built environment, whatever the case may be, or social vulnerabilities, if we can address some of those contextual concerns, we can actually influence how much people feel the effects of climate change in their health. So as I just said, not everyone experiences the health effects of climate change and extreme climate events the same way. Different populations are especially at risk or especially vulnerable to those impacts. So we know older adults are often more vulnerable to extreme climate events, especially if they are electricity dependent. So, the people who are often included on the HHS Empower maps, for example, of electricity dependent Medicare beneficiaries. People who are reliant on the power grid are maybe more vulnerable in extreme weather events or things that cause an issue to the power grid. We know low-income communities are often much more at risk for physical illness, mental illness that can relate to extreme weather events or extreme climate events. Children are more at risk, particularly around heat and heat stroke and heat-related illnesses. And communities of color are also more at risk to a lot of climate concerns. That's often due to long-term systemic issues in housing practices and things of that nature. So let's talk a little bit more about each of these impacts and how they actually affect health. So I want to start with extreme heat. That is something that we are all very familiar with. We dealt with quite a bit in 2023. So I included here a graphic of heat wave characteristics in the US from 1961 to 2021. And you can see here for frequency, duration, the length of the season, and the intensity of heat waves, we've seen pretty steady increases in all of those areas in terms of how many heat waves that we've had, how intense they've been, how long they've lasted, etc. And so heat waves often include higher humidity, it's increased temperatures, obviously, and that can lead to things like heat stroke, dehydration, and other heat-related illnesses. And certain people are more at risk for these health impacts than others. People who work outdoors obviously are at a higher risk of exposure to heat-related issues. Student athletes, I grew up in Texas, and I remember when we would have, or I didn't have this, but when our football teams would have two-a-days in the summer in the extreme heat, there were often students who got very ill or passed out, or they would have to cancel practices because it was just too hot for student athletes to be outside. We also know people in cities are especially vulnerable to extreme heat. There's a phenomenon called urban heat islands that basically in cities, there's limited green space and there's a lot of concrete and asphalt, and that can lead to more extreme heat. So cities often feel heat in a much more extreme way than other areas do. People without air conditioning, this was a big issue. I don't know if y'all recall in 2021 in the Pacific Northwest, they had a heat wave that was very deadly for the region. There were a lot of people in that region who just didn't have air conditioning in their homes, and they weren't equipped to deal with that level of heat. Also, people with chronic disease, pregnant women, older adults, and young children. So the heat impacts that we're seeing are happening now. This is all going on now. This is not a future impact. So this is a map showing heat-related ER visits. It's the number of heat-related ER visits per 100,000 visits over a really particularly hot week in 2023. So first week of July in 2023. And you can see that across the country, almost in every region, there were a high number of heat-related ER visits. So we're seeing that heat is driving more people to the hospital in extreme heat events, and it's causing health impacts and really surges on our healthcare systems already. So here at UNMC, we have been doing a project mapping heat in Omaha, just to get a sense of where certain parts of the city may be more or less vulnerable to the impacts of heat. And I won't get too far into this, but it's been very interesting to see that certain parts of the city really are more vulnerable to heat. They've seen more hospitalizations, they've seen more health impacts. A lot of this, the area of vulnerability is in areas of the city that were affected by redlining, which is a racist housing practice that went on for many years. So this demonstrates that intersection between social vulnerability and the impacts of heat or climate. So let's talk a little bit about flooding and drought and extreme weather. We've touched on those already, but let's talk about how they actually affect health. So extreme weather, this can be a little bit of everything. You know, that's the heavy downpours like we were talking about, floods, droughts, major storms, and the health impacts that we see around extreme weather are more acute things. It's injuries in the moment, displacement, people not being able to stay in their homes, or also death. And folks who are at risk for that, a little bit of everybody, really. When severe weather impacts our community, everyone is impacted. But particularly at risk are people who do not have easy access to evacuation routes or who cannot easily evacuate their homes. They are especially at risk. And these are people with access and functional needs, particularly at risk for these concerns. So I wanted to go back and talk about the 2019 floods again, just real quick, because they were such an important event in our region, and they had a significant effect on health. So just as a reminder, the 2019 floods caused $10.8 billion of economic loss. There were 3 deaths, hundreds of people were displaced. It was the costliest inland flooding event in U.S. history, which I think is really interesting. There were multiple hospitals that sustained damage, multiple long-term care facilities or nursing homes that were evacuated. So there was there were impacts to health there in terms of those healthcare facilities being affected by the flooding. But I also want to talk about how this impacted people's ability to access care. So you may recall when the 2019 floods happened, a lot of people were cut off from the rest of the world. There were homes where people could not easily get to town. They couldn't get to a doctor's office. They couldn't get to a pharmacy or a hospital. So if they had a health issue or they needed a medication, they did not have a way to get to those resources. There was damaged infrastructure from hospitals that were damaged, roads. People didn't have an easy way to get to and from. This was a real interesting look at how extreme weather events can actually not just impact somebody's health, but also impact their access to care, which can have real impacts on health outcomes down the road. So one of the other health effects that we see with climate change and extreme climate events is on water quality. So I think a lot of times when we think about a changing climate, extreme heat, whatever the case may be, we think about water quantity, but we don't always think about water quality. And so water quality can be impacted by drought, extreme weather, heat waves, flooding. All of those things can lead to more parasites or contaminants in our water, whether it's surface water or groundwater. There was an interesting study done showing that private wells can actually have increased levels of arsenic in drought events, which is terrifying. Nobody wants arsenic in their water, but private wells are kind of the Wild West of water quality because they're unregulated. So people don't necessarily know what's in their water. So this is a major concern of a health issue that can arise when we're dealing with a drought. We also have issues of air quality. This can come from things like increased wildfires, smog, pollen, and mold. In Region 7, we've been impacted by wildfires occurring in the region. But as we all know, we've also seen a lot of wildfire smoke from other regions, whether that's California or Pacific Northwest or Canada. We're getting a lot of that smoke in our region as well, which is impacting our air quality. This can lead to asthma, respiratory issues, allergy issues, and the people who are most at risk for these concerns are really people who have pre-existing health conditions, whether it's heart-related or respiratory-related, that could be exacerbated by these concerns. So I've mentioned this a few times now, but one of the other things that we see with climate change and extreme climate events is an increase in vector-borne diseases. When we see higher temperatures and changes in rain patterns, more standing water, there's different ecosystems there that are at play, and vectors like mosquitoes or ticks or whatever the case may be have different places where they can live and grow and spread disease. So with this, we see more Lyme disease, more West Nile disease, dengue, etc. A lot of those vector-borne diseases. I saw a map recently, and I should have included it, of what portion of the country is impacted by Lyme disease, and it has been steadily growing. And there's probably multiple explanations for that, but some of these climate-related issues are also a factor in that. The people who are most at risk for this is really anybody who spends time outdoors and could be exposed to these vectors. And then I also want to include this graph here showing that locally acquired dengue cases, so not acquired through travel or exposure in somewhere outside of the US, have actually increased over the last 10 years. So that can at least be partially attributed to climate concerns. All right, so mental health issues is an area that people are just starting to explore a little bit more to see how climate affects mental health. So we know that this can result as a result of increased extreme weather events, extreme storms, things like that. Those are the sort of things that can cause PTSD, anxiety, stress, depression, any of those mental health issues. And they can cause that because it's displacing people, it's disrupting their livelihood, disrupting their homes, disrupting their work, whatever the case may be. And the people who are at risk for these mental health issues, it's basically everybody: children, older adults, pregnant women, people with mental illness, lower socioeconomic status. all of the people you see here. I also want to call out first responders. People who are being called to deal with these kind of extreme events over and over again are probably going to be dealing with some mental health issues. Also, people who rely on the environment for their livelihood. That can be ag workers, ag producers, whoever the case may be. And I want to talk about that just a little bit further. We see, especially in drought events, that there is an increased rate of stress and mental health concerns with farmers. Farmers are dependent on the land for their livelihood. It's how they provide for themselves and their families and their communities. And we've seen a number of studies now that show that where drought conditions exist, there's often increased stress levels and mental health concerns for farmers. We're also seeing increased suicide rates with farmers when there's a drought event. And I think this is especially pertinent because a lot of times mental health can be stigmatized in some of these smaller communities. And so we don't know if these individuals are going to be able to access the kind of mental health care that they may need, or if they're going to feel comfortable seeking out mental health care. So this is an area that we really want to explore further and see how it can be better addressed. All right. So now that I've hit you with a lot of doom and gloom, let's talk about what we can actually do to address some of these concerns. So I know we've probably got a pretty decent healthcare audience today. So thinking about what can healthcare do about climate change and health impacts. One of the best things that people in the healthcare industry or in healthcare facilities can do is to participate in research before, during, and after climate-related disasters to understand the impacts and the vulnerabilities of the community, the vulnerabilities of the hospital, all of the different concerns there. Also, it's really important for researchers to be able to access some of that hospital and other healthcare data to better understand what the impacts of climate-related disasters could be. Also, healthcare is in a unique position as a big energy producer and consumer to build more climate-resilient health systems. So as they start to build health systems, thinking about where are they especially vulnerable as a facility and where can they adapt processes, procedures, buildings, whatever the case may be, to climate concerns. How can they make their facilities more accessible in extreme climate events or in climate disasters? And then also educating and training the next generation of health professionals. This is something that we at UNMC have been really focused on and really proud of. We have got a number of learning tracks for the med students here to learn a little bit more about climate and health so that they can then take that to their future patients. We know that primary care providers and other types of physicians are often people's most trusted messengers and source of health information. So if we can educate providers on how climate impacts health, then they can then spread that message to their patients and reach out to their patients about concerns there. Now, in case we have healthcare coalitions here on the call today, I also wanted to include some things for y'all to consider as well. So one of the first things that coalitions can do is in your annual hazard vulnerability assessments, include climate change, include extreme climate events in your assessments. Be thinking about where is your coalition and the facilities in your coalition especially vulnerable to these concerns. I also like the idea of conducting exercises around climate-related threats. I know that a lot of times we do exercises around more acute events like a tornado or a snowstorm or something that's really sudden, but I think it would be interesting if we started to do more exercises around some of the slower moving or, a little bit more insidious climate-related threats as well, like a drought event. What would a hospital do if there's an event that's affecting water supply? You name it. And then also, I would encourage really everyone to connect with your state climatologist. Each state has a climatologist, and they are your best source of information on climate-related concerns for your state. They'll know best what are the risks, hazards, threats for your particular state and the concerns that you need to be aware of. So I have another question for you if you want to put it in the chat about what would help you to address climate change in your community, in your healthcare facility, wherever you work or live. or where you're based, what would be helpful to you? Because I would be interested to know, and I'll take a look at those answers in the chat. And while you're thinking of those, I also wanted to share something that we've been working on at UNMC that I'm really, really excited about, and that we are about to release. This is a drought and health messaging toolkit. And so we created this toolkit for public health practitioners and healthcare providers to get a better understanding of how drought, just one specific component of extreme climate events, how drought impacts health. And so what this toolkit does is it provides a really base level education on what is drought, what are the stages and levels of drought, how does it affect health, where can people find more information on health. But then the bulk of the document is actually sample messaging that healthcare providers or public health practitioners can use with their patients or with their communities to help them think about health concerns that might exist around drought. So for example, there's some language in there about, I see that we're at a D3 level extreme drought. In this sort of event, we know that there are often more mental health issues going on. Have you been experiencing more stress? Like different things like that physicians or public health providers can use in their communities to really tailor messages around drought. So we're really excited about that. That'll be released in the next month, I think, and happy to share that resource. So I want to close with a few quick thoughts. Number one, if you take nothing else from this presentation, I hope you have seen that climate change is a significant health threat. Everybody's vulnerable. Some people are more vulnerable than others, but everyone is vulnerable to these health impacts. We can gain a lot by combining expertise. Climate scientists, healthcare providers, public health practitioners, emergency managers, we all have a lot to gain by working together and combining our expertise. And then finally, something that probably everyone on this call is aware of, the more we prepare for and plan for and understand different types of disasters, the better we can respond to them and mitigate the impacts. Without that planning and preparedness, the effects of that disaster is going to be a lot worse, and that goes for climate change as well. So with that, I will pause for questions and take a look at the chat as well to see what people have said.
All right. We do have actually a couple of questions in here, Rachel. So I don't know if you want to scroll through the chat first or do the questions or multitask here.
We'll multitask. Let's do the questions here.
All right. So it's the first one here. It says, if climate anomalies are determined relative to the long-term average temperature, are you able to say a little about how the long-term average temperature is calculated? That might be helpful in talking to folks to be able to say something about baseline.
Yeah, that's a good question, Caleb. So that question, and I should say here, I should have said this at the outset, I am not a climate scientist. I am a lawyer who is working in climate. So forgive me if I say anything not helpful on the science portion. But that's a good question. I think really I could give you an answer, but I think it would be more helpful to actually link you to the information about how long-term average temperature is calculated. What I go back to with that slide, maybe I can go back to it really quickly. Well, it'd probably take a while. But that slide that shows that difference of global ocean and land temperatures from the anomaly. Well, Caleb, I don't know how it is calculated at the outset, but it is just interesting to see that the change is so significant of 2 degrees Fahrenheit now to what it was 1850. I can look into it more about how it's calculated for you though, Caleb. All right, where do heat events fall in the billion-dollar disaster event graphs? Okay, and I think someone just raised their hand. So the heat events, I think, fall under the drought category. They have them categorized together there. Okay. Here in Vermont, we ran into competing incidents at the same time. We had the major flooding in July 23 and had air quality alerts from the Canadian wildfires. Do you have thoughts on how to create messages for opposing needs? Yeah, that's a really good question, Eric. I think this is something interesting that we have seen with a lot of different types of events where, particularly here in the Midwest, we've been in drought settings, but then we have these extreme floods, and it's very difficult to explain to people how to respond to both of those types of things at the exact same time. So I fully appreciate what you're saying here. I think you have to tailor the message really to what is the most acute concern at the moment while still being cognizant of what are the long-term concerns that need to be addressed. So for that example, Eric, thinking about how can you mitigate the mold concerns while also protecting your health and air quality for the smoke. It just has to be really carefully crafted to account for all of those different concerns. I think someone raised their hand, or maybe there was something in the chat.
Well, there's one quick one was asking about sharing slides after
Yes.
this, and I will say to everybody I did put in the chat, we are recording this. This will be posted to both our website and our YouTube channel afterwards. I would, of course, ask your permission as far as web sharing slides or anything like that. I defer that to you. We can work with that. There is another comment in here. It kind of has a question wrapped into it that I wanted to bring up. It's asking about, isn't including climate change on an HVA kind of double dipping when you have the same events on the HVA that are the result of the climate changes and floods, hurricanes, tornadoes, etc. Those specific events are already on the HVA and being evaluated, but adding climate change as the category is saying the same thing, kind of thing. Any thoughts on that, I guess?
No, I think that's a good point. I think what I would say when I think about including climate change in the HVA, I see that as thinking about long term, if you know you're going to be having more intense floods, hurricanes, tornadoes, whatever the case may be, more frequent, kind of looking at the totality of the issue, thinking of how that will impact your coalition or your healthcare facility, whatever the case may be. So I see that as being more the comprehensive overall umbrella look at things. And then obviously you're accounting for each of those specific climate threats individually, but taking a look at what that means overall if you're having more frequent, more intense of all of these different events occurring around the same time. Does that make sense? Okay.
Oh, that's okay, Scott. No worries. We
You're
found the
good.
question. Let's see. Are you aware of who in the region has completed HVAs? From Renee, would you have to be a little more specific as to the region? Renee, are we talking about just Region 7 or?
I think I'm pretty sure every healthcare coalition and healthcare
Yep.
facility has to do an HVA. So probably just about everybody has done them. In terms of how frequently, I believe that's an annual requirement, but someone please correct me in the chat if that's wrong. I don't know if Region 7 has done an overall HVA. I don't believe so, though.
They, not to my knowledge, they tend to be rolled up from healthcare facilities into more of a healthcare coalition level. I think, and then it can be rolled up into maybe a state level. But if you look at the region as a whole, your threats and things like that are going to end up being so similar across all of them. I'm not sure at that point in time if it's really overly useful. It might be too diluted once you get up to a whole region level.
Right. And yes, thank you to the people in the chat who mentioned it's every 2 years.
Let's see, another question come in. Any comments on atmospheric rivers? Are they currently predictable?
Oh Lord, that is definitely a climate science question, and I apologize. I do not know a good answer for that. I also appreciate there was a comment in the chat about talking more about mental health issues and how it's okay to seek help for mental health issues relating to climate, or how extreme climate events can, impact livestock or different things like that. And I appreciate that comment. That is something that we've worked really hard on helping to kind of destigmatize seeking mental health care for these kinds of issues. Any other ones that I missed that you see, Tom?
Not that I am seeing in there.
Well, if anybody has any other questions, please feel free to reach out. Or if there are questions that you had that a real scientist should answer, let me know and I will get answers for you. And I appreciate your time.
Yeah, and I mean, if there's any other follow-up questions, feel free to reach out to us, whether it's at our website or via our email. I can put our email in the chat. I did put the information in there for getting CEs from this, as well as a link to our events calendar for various, whether it's in-person training, webinars, or anything like that. You'll also receive a follow-up email that'll have the CE information on there as well for folks who may have missed it in the chat or anything like that. We did have one last minute question come in here. Let's see here.
Yeah,
Stated.
I
Oh, sorry. Go ahead.
Yeah, so Patrick asked a question about, maybe over connecting cause and effect with climate change and dengue fever. And you're right, and I apologize if I misstated that. I think climate change may be a factor in the increase in dengue fever. I don't think it's the sole cause or the sole factor, but I think it is a factor to be considered pretty heavily. But I do appreciate the clarification that we can't always say it's a direct A to B cause and effect.
Yeah. Correlation is not causation, is it? Ever.
Right.
Okay. Seeing a lot of thank yous. So at this point in time, I don't see any more questions. Thank everybody for coming and participating in our webinar today. Thank you, Rachel, very much for presenting for us. And with that, will actually give a couple of minutes back to you. And thank you all for coming along.